So what we're talking about in the revolution of healthcare is changing our culture. It's changing what we do, and it's changing how our presence can influence those around us. And it's really about shifting our attention. It's shifting our attention from one way we were trained to a new way of facilitating health and healing. But we all are wrapped up in this culture, this belief, this process. We all have these neural networks in our brain that leads to an enculturation of beliefs that make things easy and normal. And we get used to that. But this is wrapped up in this complexity, right? Every patient we see has a unique story. All of us have a unique story. It's complex. It's not as easy as one supplement or one pill. It's complex. So I want you to look at this. And sometimes it works better than others. But a lot of times when you look at this, there's a lot of movement. I had to take Dramamine the first time I looked at this. And there's movement because we're focusing on all the different almonds at once. We're creating this like nystagmus, where we don't see it as it truly is. We see it as we are, multitasking, trying to do a lot of things at once. Now allow your gaze to focus on just one almond. Just one. What happens? It becomes still. It becomes authentic. You see it as it truly is, not as who you are. This is what we need to do with patients when we're having a healing-oriented encounter. Get out of our chaos. Drop into the patient's presence and be there with them so we can be better diagnosticians and more powerful. I sound a little silly saying healers, but it is what it is. It's influencing self-healing mechanisms when we clear our clutter and then we help the patient clear theirs. The awareness is key, that we drop in to the patient's story and we become aware of what they're asking of us. We then start to awake to what really is, right? John Kabat-Zinn says when we drive home from work, we're often somewhere else in our mind. We don't realize what we're passing on our way home from work. This is dropping in and awakening to what really is around us. You go for a walk in nature. Patrick's guided imagery this morning allowed us to touch authenticity, nature, beauty. And we can do that. That's the joy of this job, right? Is to do that in the practice of medicine. And then that leads to this authenticity, seeing things as it truly is. And here's the fun part, that we will never have a double-blind placebo-controlled study to explain, but we know it's mysterious. It's awe-filled. That when we clear the clutter, we touch this beauty in our work. And it's fun. And when that happens, it doesn't happen very often, right? It's like golf. One shot gets you going back. That's about the only good shot I get is one. But it keeps me going back. Maybe, hey, I could maybe get more of those. It doesn't happen very often, but when it does, it really gives us hope that this was the work we were meant to do. Your presence makes all the difference. Who you are, how you are authentically present with your patients, really trumps any pill, any supplement, any needle we could place. So thanks for allowing me to share my passion, and thanks for the work that you do.